Hello, and thank you for tuning in to our first ever podcast, Conversations with STOPit Solutions. This is a space where we bring you advice from experts who specialize in helping to make our world a more positive place. Cyberbullying. It's a growing epidemic that we see in the news practically every day. According to stopbullying.gov, 15% of high school students were electronically bullied in the past year. What's more is that over 70% of students have said that they have witnessed bullying happen to someone else around them. In a world full of screens, figuring out how to safeguard can sometimes feel like an uphill battle. Fortunately, there are people and organizations working to fix that. Today, we are joined by one of those people, Dr. Jenna Meyerberg. Dr. Meyerberg is a PhD and licensed professional counselor at Developing Wellness Therapy Group in Brick, New Jersey. She specializes in helping the child and teenage population. Dr. Meyerberg also recently completed her doctorate in mental health counseling, during which she conducted a study about feelings of envy and changes in well-being that result from Facebook use. Dr. Meyerberg, thank you for joining us today at STOPit Solutions. Welcome to our Bellworks office in Holmdel, New Jersey.
Thank you so much for having me today.
We're so excited that you're here. Dr. Meyerberg, it takes a special kind of person to be a doctor in mental health counseling who works with children and teens. How did you get started in your career?
I went through some struggles myself as a child, a teenager. And even though my dad connected me with therapists, they really were more focused on working with adults. And there's a really big difference between the work that's done with adults and work that's done with children and teenagers. And I never felt like I really got the help that I needed or really would have benefited from. So once I got into college, I knew that I wanted to be part of the helping professions to try and be that person for other children and teenagers.
You currently are practicing at the Developing Wellness Therapy Group in Brick. How long have you been there, and why did you choose to join that practice?
It's a very new practice. They've been open for just about a year and a half. I've been with them for about a year, and I joined them because it allows me the freedom of having a private practice, but also the camaraderie of working with colleagues. In the field that I work in, it's so important to stay connected with other professionals for prevention of burnout, for collaboration on cases, to get different points of view, different perspectives on the work that I'm doing with clients, and also just to have a little bit of social interaction throughout the day, because therapy can be very lonely work. So working in this group practice has been a really great fit for me. Each of the therapists that work there have a different specialty. We have a therapist that works primarily with trauma victims. She does EMDR. We also have a therapist that works primarily with couples. And then I fill in that gap working with children and teenagers.
So you brought something out regarding burnout. So
Yes.
I'd love to chat a little bit about that. I mean, you
Sure.
deal with some heavy stuff.
Yes. A lot of what I do is really pulling out and talking about some really negative experiences that my clients have had. I sit with them in these really deep emotions. And not to say that every session is like that. We certainly have a little bit of fun too. But really the purpose of counseling is to work through some of the pain so that we can heal and move forward in life. A lot of self-care is really important in this field. So learning how to separate myself, leave work at work is really, really challenging because I make such a personal connection with all of my clients.
I feel like that's actually incredibly important to what you do, but also could be something that everybody in every profession should really be doing some self-care.
Absolutely. I think we live in this culture where it's go, go, go all the time. Especially now, I'm a new parent, and becoming a parent myself has really given me a very different perspective on what it means to have kids and be a working mom or a working parent, because my husband works as well. It's really 24 hours a day, 7 days a week, the job of parenting, and then on top of the work we do in our careers. So I don't think it matters what field you're working in. If you are giving yourself to someone else, whether it's coworkers, whether it's your boss, whether it's your child, you have to replenish what you're giving
So very important for all of us.
Yeah.
So congratulations, by the way.
Thank you.
So you recently became a mom.
Yes.
And so much of your focus is around children and
Yes.
their well-being. Has that shifted your point of view at all?
It has really given me some insight into what parents are going through when they're coming through my doors. So I've always been able to see it from a clinical point of view and still empathizing with parents as people. But now I have a little bit more of an idea of what it means to really worry about your child's well-being, worry about the world that they are living in, worry about how their peers are treating them.
Yeah.
And also a feeling of hopelessness or helplessness sometimes in not being able to always protect them from the realities of the world.
Yeah. So I'm actually a parent of a preteen. And I'm already starting to see that as your child gets bigger, their problems can get bigger.
Yep.
So what advice do you have for parents as well as educators who deal with children experiencing negative situations like cyberbullying?
One thing I like to encourage my clients and the educators that I connect with is look at these children as little people. Sometimes it's hard for us to remember that they have good days and bad days, just like adults. They go through mood changes. They have ups and downs. They're affected by all of the same stressors that adults can be affected by.
Yeah.
And when we lose sight of that, we aren't able to really see a very big picture of what's going on in their lives. So really taking into consideration everything that's going on for this child in the same way that we may do that for an adult. Also, treating children with respect, believing in what they say.
Yeah.
So often parents will tell me their child lies frequently, and so they don't believe their child when they say certain things. And I appreciate that children can sometimes be less than truthful. That's certainly
I know what that's
true.
like.
It's definitely a fine line to walk. And I always say to parents, you are the expert on your child. So I take that into consideration. But at the same time, when we stop believing what our children are saying, we really run the risk of having them push us away and be less likely to talk and to speak up when something is really happening.
Yeah. So a lot of your studies, when you received your doctorate, were focused around social media use in youth. Can you share with us your thoughts on how kids are affected by things like Facebook?
Yeah. Well, one thing I learned is I had a client tell me that Facebook is for old people now. And I didn't think at my age I would be called an old person quite just yet. So it really has been an eye-opener for me, though, how quickly social media is changing and evolving.
Yeah.
I was able to do a study on Facebook, but by the time I got to actually do the study, Facebook was not the most popular social media site. So this can be very confusing for parents, educators, because as soon as you start to understand the lingo, understand the technology, they're on to something else. What I find, though, is some common threads throughout each of these apps. The ability to update people in real time, the ability to connect with friends and strangers, use of word, use of pictures, and now use of video seem to be pretty common throughout all of the different apps. Facebook, Instagram, Snapchat is another one. It's the way that teenagers particularly are connecting to their world. So many times parents are telling me they spend way too much time on the cell phone. I want them to get off the cell phone. To an extent, yes, I think that limiting the amount of exposure to screens is beneficial, but to ask a teenager to give it up completely, I don't think is realistic in today's world. This is how they are making friendships. This is how they are maintaining their friendships. So I think we need to accept that this is where their socializing is happening. And we need to make sure that they are being responsible and that we're monitoring it. social media really gives people, I think, an inflated sense of importance. And there's a lot of danger in that. Teenagers are notorious for thinking everybody is watching what I'm doing, everybody cares about what I'm doing, when in the past, the reality is no one is watching them like they think they are. But now they really are putting themselves out there on a platform where people can see them. They also are following influencers. So these are people who aren't celebrities. You may not even know who they are, but because they have some social media account, kids and teenagers are now following them, following what they're doing. And when I say following, I mean mimicking what they're doing, not just, following, looking at their posts. And there's no regulation on what's being posted online, at least not yet. YouTube has really tried to create some boundaries in making a YouTube's kids channel. But again, the technology moves so fast. I have parents that are telling me they have no idea how their kids are viewing this material that's so age inappropriate for them. So it's an exciting time. It's a scary time. And social media is really presenting new ways for kids to learn about who they are, try out different things, and they're exposed to a lot more that's not always appropriate for them.
Yeah. So monitoring sounds like it's very important, right?
It is. I worked with a very young kid recently, 5 years old, and we were really trying to figure out what was going on with him. He was having nightmares. He was making suicidal statements at such a young age. And we were trying to figure out, was he really suffering from depression? Was there some sadness going on in his life? And then we come to find out he's watching clips of horror movies on YouTube. And the parents, now I know what it's like. You can't have eyes on them all the time, especially if you've got multiple children. And I don't think it's realistic for parents to watch all the time either. But it only takes a couple of seconds for kids to stumble on something and then start repeating the words or acting out based on it. And it's really tricky now for parents. How do I monitor this without hovering over my child, giving my child a sense of self-sufficiency? And it's very difficult. One thing I recommend is creating shared screen time space. So instead of having children up in their rooms on their iPads, on their tablets, on their cell phones, encouraging or setting a boundary that in our home, cell phones, screens are used in the common areas of the house. So that way parents don't have to be monitoring. We don't have to watch what's happening, but we always have our ears open. We always know when something is going on. So just having that shared space, having it out in the open, can reduce the chances of something inappropriate popping up on the screen. Also, gives parents a chance to intervene right away and just to know what their children are watching.
As you mentioned, going on social media is oftentimes unavoidable. But I think that's also the case for adults, especially, as well as children. So what are some tools and tips for those that are maybe older?
So when I did my study on Facebook, I studied just the adult population, and I'm finding that they are just as affected by social media and looking at other people's posts as much as children and teenagers are. Being aware, I think, of what you're looking at and who you're following on Facebook, on Instagram, is the first piece of this. So my study looked at whether or not self-goals, so self-important goals, had anything to do with what people may feel when they're looking at Facebook. So, for example, people who have a goal of losing weight, when they're going on Facebook, are they seeing other people post about being successful in that weight loss goal? And who are they seeing being successful? Is it a close friend, or is it a celebrity that is achieving this goal? And I found that there is a difference between who they are seeing being successful in a goal that's important to themselves, and seeing a close friend be successful at that goal actually produces more envy, more negative feelings than seeing a celebrity or somebody that you're not close with. So Facebook gives you the ability to unfollow certain people so you can still remain friends with them, but not see their posts automatically on the news feed. I would really encourage people to take advantage of that. If you want to know what's going on in your friend's life, you can go to their Facebook page directly. I think reaching out to them personally is a much better option, but there really is no need to passively follow what every one of your friends is doing. And so knowing that following or seeing your close friends achieve something that you want to achieve, knowing that that can create really bad feelings, take advantage of the opportunity to put them aside. I actually think Facebook gives you the option to snooze for 30 days. So just give yourself a break from being bombarded with all of this information. Because you're right, I'm guilty of it myself. I have a hard time putting the cell phone down. So if we know it's going to be in your hand, if we know you're going to look at it, make some little tweaks so that you can create some buffer from those negative effects.
So I have a confession. We have spoken with you before. You actually wrote a blog post for us on STOPitSolutions.com a few months ago.
Yes.
What was it about?
It was about cyberbullying. How is cyberbullying different from bullying of the past, and why it's important that adults are stepping in and doing something about it? I would really like to talk about the important role that parents have in all of this.
Yeah.
The research shows that parents' involvement with their children, particularly involvement with the children who are bullying, is much more predictive of reducing bullying than involvement with the victims. So again, it's really about getting parents involved. When I work with a child or a teenager, I let my clients know from the very first session, your parents need to be involved. I say that to the parents. This is not an opportunity for you to drop your kid off for 45, 50 minutes and then you leave. Whatever is happening with your child has to be addressed outside of this therapy room. What we can do is brainstorm, find out what's going on, but then it's up to the parents to really address the underlying issues. When parents are involved, there's so much opportunity for that child to learn, to grow, to fix the mistakes, to fix the problems that are going on in their lives.
Yeah, that's really important.
There's a lot of focus on helping the victims of bullying and really not a lot out there for the bullies themselves. And a lot of people are surprised to hear that there's a significant overlap between bullies and victims. At least 30% of teens, children who are victims of bullying are also bullies themselves. That's a huge number.
Wow.
Other studies have it at an even higher percentage. What we don't realize is that when children, teens are bullying, maybe harassing other peers, they may be reacting to some trauma that's happening in their homes. And the research actually supports that the majority of teens and children who bully others are coming from homes where there's high levels of conflict. There could be domestic violence. There could be other childhood traumas, significant stressors that they've experienced in their lives, and they're taking it out on their peers. They may feel powerless at home, and then they go to school, and they're trying to regain a sense of power by putting other people down. And then when that happens, and it's reported, they get in trouble at school, and then get in trouble at home, and it's becomes this really vicious cycle for them. And then there's no motivation for them to improve because nobody is addressing the underlying concern. I would really love to see bullies be recommended for counseling not just the victims. A lot of times when the victims of bullying get a little bit of support, could be from counseling, could just be from family and friends, they bounce back and they tend to do really well when they're validated and when they're supported. But the bullies continue to go out there and struggle with these issues that nobody is addressing. And I really love HIB in schools right now because it gives educators an opportunity to identify children that are at risk for being victims, but also those that are bullying. Let's use that information to get help for those kids. Let's recommend some counseling for them. Let's encourage their parents to intervene, because that's where we can really start to break that cycle.
Yeah, that's a great reminder and such a good point to not be villainizing the bully, but instead be providing support to help the bully. So for our teenage listeners specifically, who've maybe dealt with things like cyberbullying, what resources do you suggest they use?
A lot of teens have told me that they're hesitant to reach out to guidance counselors, school counselors, because they don't feel that anything is going to be done about what's happening. Sometimes the reason that nothing is done is a lack of evidence or a lack of proof. So to have the ability to capture what's happening online, like I know the STOPit app allows for that. I think that is such a tremendous resource for teens and for schools because it's very validating. It lets teens know we see what's happening and we're going to do something about it. If there are other trusted adults that they can go to in their lives, if it's not a guidance counselor, somebody that's going to believe them, like I mentioned, somebody that they know is going to validate what's happening, important resource. Beyond that, technology is moving with crisis support. So in addition to call lines, there are also texting lines for crisis support. Second Floor Youth Hotline is one that I give out a lot. So kids who are being bullied or are having negative thoughts about themselves, thoughts of hurting themselves, certainly we want them to reach out to an adult, but they can also text a crisis support line and get connected with a crisis counselor immediately without having to make a phone call. So we're really meeting kids where they're at in terms of what they're comfortable doing.
Yeah. So this is what I've gleaned. More self-care as people, as humans. So whether you're old or young. More self-care, monitoring screen time, shared screen, what was it?
Shared screen space.
Yes, I love that. Taking advantage of maybe evaluating who you're following and maybe unfollowing or snoozing. Yeah, what else am I missing?
Let's unplug for a little bit.
Yeah.
You hit the nail right on the head when you said adults have a hard time putting the phone down. But I can tell you 100% of the parents that have walked through my doors that want their child to put the cell phone down also struggle to put it down themselves. So let's do it together as a family. Let's do it together, adults and kids. We need to put the cell phone down. We need to put screen time away. If kids see you taking unplugging seriously, they're going to do it too. But it's not just let's unplug and now what do we do? Kids are often lost when we ask them to stop with screen time because that screen time is what they're doing to occupy their time. So I think if we all do it together as a family and then create some other family activity, give kids something to do. Know ahead of time some different activities that they can be involved in. Know ahead of time what you're going to do together. It can really cut down on some of the pushback that teens are going to give when you ask them to unplug. And who knows, you might even have a little bit of fun yourself.
Yeah, you're right. Everything you've said, I feel like I'm guilty of.
And you know, I'm guilty of it myself as well. All of us, we're all works in progress. It's not about achieving perfection. It's not about doing everything 100% of the time. It's about being open to changing and adjusting what we're doing and trying to help our kids learn to be flexible as well.
Mm-hmm. Well, this has been so insightful. I feel like I've learned so much, and I hope that our listeners have as well. So thank you so much for your time. For those that are listening that want to maybe connect with you or find out more about what you're about, is there anywhere that they can go to do that?
The best way to connect with me is through Psychology Today. If you go to psychologytoday.com and then just search my name or Google my name in Psychology Today, that's the best way to reach me. Or developingwellnesstherapygroup.com, where you can connect with me or any of the other therapists that I work with.
Well, Dr. Meyerberg, on behalf of STOPit Solutions and our listeners, I'd like to thank you for visiting with us today and sharing your expertise with us all.
It was my pleasure. Thank you.
STOPit Solutions creates safer places to learn, work, and live. If you are interested in hearing more about how our anonymous reporting products and 24/7 monitoring services can help your organization create a speak-up culture, please visit STOPitSolutions.com and follow us at STOPitSolutions on Facebook, Twitter, and Instagram. Any and all content found in this podcast, including text, images, audio, or other formats, were created for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a medical professional with any questions you may have regarding a condition. Never disregard professional medical advice or delay in seeking it because of something you have heard about on this podcast. The Conversations with STOPit Solutions podcast is produced by Jonathan Hallmock. I'm your host, Agatha Ash, signing off. We'll see you next time.